Hi, I am Claudette Joint and I am a case manager and clinical lead with Unite Professionals Limited. I have attended the Complimentary Rehab Assessments that Dorset Orthopaedic offers at both their Manchester and their Burton-on-Trent clinics. After I attended the Complimentary Rehabilitation Assessments, I received a comprehensive but concise report. This report outlined the background information of my client's current situation, their wishes and their aspirations, and a full objective examination from the therapists involved. So in my client's case, there was a prosthetist, an orthotist, and a physiotherapist that offered their opinions. The report also highlighted any psychological risks and then continued to outline the recommendations and costs based on the assessment findings. There is a very clear rehabilitation plan with the recommendations which outline the prosthetic prescription and the rehabilitation or therapy needs that are needed to progress my client's functional goals and then his ultimate recovery. These recommendations are fully costed, including quotations for all the components and the fitting needs, and also all the therapy or the rehabilitation that's offered alongside the prosthetic provision. The rehabilitation plan includes a breakdown of all the recommended interventions with great clinical reasoning and evidence from the assessments to explain why they're needed and how they support the client's recovery. These recommendations align with the client's own goals and are offered in a way that supports prioritizing these within the rehabilitation pathway. In my client's case, there were initial recommendations made for 6 weeks, and then a further review highlighted his needs for a further 6 to 12 months. In each case, it was possible to offer the costs for each recommendation separately so that they could be progressed at the appropriate time, while giving an upfront cost to me as case manager, the referrer, and the funding party so that we know what to expect. It did allow me as a case manager to request funds in a timely way so that we avoided any delays in provision. Dorset Orthopaedics have a 72-hour turnaround target for the CRA report and the quotations. Following each assessment I attended, I don't think I waited more than 2 days for the report and the quotations to be received. This was super important for my client because his functional goal meant that we only had 6 weeks to get him up and started. As we received the recommendations and the quotations speedily, we could present this to the funding parties quickly, which then allowed them to consider, make a decision, and approve the funds, enabling us to progress those recommendations without delay, and ultimately meant that the client met his goals within the required 6 weeks. Having a clear, detailed and structured report to outline my client's needs from the outset allows me as a case manager to consider the recommendations and ask the necessary questions before I present this to the funding parties. Once I have shared the recommendations and the costs, there's very little uncertainty because as the clinical reasoning is thoroughly detailed and evidence, I've quite often answered the why before the question is even asked. Having all the necessary information allows me as a case manager and therefore the funding parties to make informed decisions. It also allows me to engage the client by explaining to him why certain components are necessary, how provision can be prioritized, and also gives my client ownership of the recommendations and therefore his rehabilitation. This all supports me as a case manager to get better outcomes for my client by identifying and providing the right support as soon as possible.